The closure of a critical federal laboratory, which had been instrumental in monitoring drug-resistant gonorrhea and other sexually transmitted infections, STIs, marks a devastating blow to public health efforts in the United States. Scientists are now sounding alarms over the loss of crucial surveillance and research capabilities that were essential in tracking the emergence of antibiotic-resistant gonorrhea, a growing global health threat. The abrupt termination of the lab's operations has left many questions unanswered and left researchers scrambling to understand the full implications of this loss. The decision to cut the lab's funding and eliminate the expertise of its staff has created a void that may be impossible to fill in the near future, jeopardizing efforts to control the rising tide of STIs in the country. For years, this lab had gathered and analyzed samples of gonorrhea and other STIs, working to understand the genetic makeup of pathogens and their resistance patterns. It was home to the largest collection of gonorrhea samples in the world, 50,000 specimens that allowed scientists to track changes in the bacteria over time. With gonorrhea evolving rapidly and becoming resistant to nearly all available antibiotics, this lab was a critical resource for monitoring the development of resistance and for developing strategies to combat the disease. Now, without the expertise to process these samples, it is unclear what will happen to them. Roughly 1,000 unprocessed samples, along with dozens more on their way to the agency, have been left stranded, and no one is available to continue the vital work that had been done for decades. This development comes at a time when rates of new STIs are soaring in the U.S. In 2023, there were more than 2.4 million new STI cases diagnosed, the highest number in 2 decades. Gonorrhea alone accounted for nearly 600,000 of those cases, with a growing concern over its drug resistance. Left untreated, gonorrhea can lead to severe complications, including infertility, blindness in infants, and even death. The rise of drug-resistant strains has made the situation even more dire. Only one class of antibiotics still works to treat the infection, but there are signs that gonorrhea is beginning to evade even this last line of defense. This loss of scientific expertise at the CDC has left the country without a critical surveillance system, which is especially troubling as new public health strategies are being considered. One such strategy involves recommending the use of doxycycline by gay and bisexual men and transgender women within 72 hours of unprotected sex as a means to prevent infections like syphilis and chlamydia. While this strategy has shown promise in cities like San Francisco and Seattle, it has also raised concerns about the potential for increased resistance to tetracycline antibiotics. This risk underscores the need for ongoing monitoring of gonorrhea and other STIs to prevent widespread resistance. But without the necessary infrastructure in place, the future of this strategy and the broader fight against STIs appears uncertain. Beyond drug resistance, the closure of this lab threatens other aspects of STI research. The CDC was also working on developing new tests for syphilis, as the current tests are outdated and unable to accurately detect active infections. Without the lab's expertise, it is unclear whether these efforts can continue. Additionally, the loss of funding and expertise at the CDC has already led to the cancellation of key studies and research grants, further stalling progress in the fight against STIs. Perhaps the most alarming aspect of this situation is the loss of highly trained scientists with decades of experience. The fired employees brought a combined total of 1,400 years of field experience to their work, and their departure has left a gaping hole in the nation's ability to respond to STI outbreaks effectively. These were not just any researchers. Many of them were pioneers in their fields, with specialized knowledge that cannot easily be replaced. The disruption of their work will have long-term consequences for public health in the U.S. and beyond. In short, the closure of this lab is not merely a financial setback. It represents a catastrophic failure in public health infrastructure. The ability to monitor, track, and respond to the growing crisis of drug-resistant gonorrhea and other STIs has been severely compromised. As scientists and public health experts continue to warn, without proper surveillance and research, we risk losing control over the very diseases that have been manageable in the past. The decisions that led to the lab's closure seem short-sighted at best and dangerously negligent at worst. Public health experts have made it clear that this is a mistake that could have serious repercussions for both individuals and communities across the nation. The full scope of the damage caused by the loss of this vital lab may not be known for years, but its effects will certainly be felt in the rising rates of STIs and the growing challenge of antibiotic resistance.